Now, brushing is something very simple. Most of us do it every day, most of us more than one time a day. But there are some nuances to it that can really make a difference. And getting into the nooks and crannies where things hide is an important aspect of what we need to be accomplishing where we're at home so much and we're doing things from home at this point. And so basically I want to focus today a bit on what you can do to get more results out of the effort that you put in. Basically, with your toothbrush, and I'm not picky on which toothbrush you use, you want to focus on the gum line. You want to get down to that gum line, basically brush into the gum line, and then anything you've broken up. You're trying to break up the plaque, physically remove it. The brush is one of the primary instruments that you have to do that. You want to go down into that gum tissue, at the gum line where the tooth and the gum meet, swirl and swish it away. Swirl, bring it away. Swirl, bring it away. Focusing at the gum line. You'll get the rest of the tooth as you do that, guaranteed. Okay? You're doing the cheek side, you're doing the tongue side, and you're doing the biting surface. Okay, those are the three surfaces that you can get with a brush. The ones that are in between the teeth, we'll take some other techniques. Okay, for right now we'll focus on the part that you can reach with the brush. Again, you want to stay at the gum line, you want to get down into those areas, especially in between the teeth, but you can only do so much of that with a brush. Okay, and then brush it away, brush it away. Okay, now this particular toothbrush has an interesting feature in that it has a roughened surface on the back side of it. That is not used on the teeth. It's actually meant to be used on the tongue. Okay, it has a roughened surface to it, and what you do is brush the tongue with it, scraping things from back to front, pulling things off of the surface of the tongue, because a lot of bacteria hide on the cheeks and tongue area. Okay, you can use that to remove the, it's kind of like dead skin, the ends of the papillae on the teeth. You're removing that, and that's a great hiding place for bacteria. So it's helpful to remove that, and that's exactly why that is put on the back side of the tooth, this particular toothbrush. Another type of brush that you can use is called a Silica Brush, and that's particularly good for getting into the nooks and crannies, those areas in between the teeth. Okay, it's meant to be, here, let's do it from the cheek side first. There are two angles to it, you'll notice. One out, one down. Okay, this tip goes at an angle down to the gum line, and you work it down in between the teeth, down into the sulcus, which is the area between the tooth and gum. That's why it's called a Silica Brush. Okay, and you work it down in there. Now, this tip is especially good for the area down in behind the lower front teeth and behind the upper front teeth. This is an area that is particularly prone to plaque and deposits. The deposits are from the saliva pooling in that area behind the lower front teeth, and the minerals are actually dissolved in your saliva, and they deposit into the first substrate they have available to them, which in this case is any plaque that's hiding along that tongue side gum line. So by getting down in here and breaking it up, physically breaking it up, then you remove the substrate for the minerals to deposit into, and things stay much healthier. Okay, nice tool. If you have the right tools, you can do a better job. Okay, so if you start to see white deposits along this area, and you have to look for them, they're pretty well camouflaged, that's plaque. It tends to be like sticky cream of wheat. It's just soft and gooey and sticky. Okay, if you start to see redness of the gum tissue along that edge, that's also a sign that you're falling behind a bit. Those are areas that you need to work that much harder on. If you're getting into all the nooks and crannies there, then you shouldn't be seeing the deposits or the redness, you should be seeing nice, firm, healthy, pink tissue. Okay, that's what you're looking for. When you're going to see the dentist, the hygienist, they'll likely tell you, okay, this is an area where you're having some particular problems. Focus on that as extra effort to make sure that that spot gets thoroughly clean. Oftentimes it's because you've got teeth that are not quite aligned and overlapping, and that gives you some challenges to work with. Take up the challenges. I realize that when most people are going in and doing this, they're half asleep, either because they just woke up or they're just about to go to bed. Do it as be present, be active in taking care of your teeth. Come off of autopilot, see what's going on in there, take a closer look, get better lighting. Try to see what's going on in your mouth on a day-to-day basis. The dentist, the hygienist, we get to see you every 6 months. If you're in trouble, maybe every 3 months. You get to see it every day. You get to make the difference. It's important that you make the most of these opportunities. I hope this has helped you to focus on tools that you can make use of, and to realize that it's the gum line where you're addressing a lot of this, not necessarily just the teeth. Thank you.